Okay, in our last video, we looked at some of the social determinants of health, and we're going to continue doing that. We started by thinking about what were those factors in those English industrial cities that could affect health. We want to think about this again today, but think about it in the US context. Today, our health and medical systems are facing an enormous strain because we don't have the beds per capita, the doctors, the people in place to deal with a massive global pandemic. Part of what's happened today is that we don't have, for example, tests for the current disease that's running rampant around the globe. Part of the reason for that is that the infrastructure and communication wasn't in place, and that tests offered by global organizations like the World Health Organization were denied by the president, who's not making great decisions about this. But that's another issue. The American health system faces unique issues. We have, for example, private health insurance markets. We do have some coverage for poor folks and for older folks, Medicaid and Medicare, but by and large, there's a big part of the population that is not covered by health insurance. We also have for-profit hospitals and for-profit pharmaceutical industries. So this means that the people who run hospitals in this country are trying to profit off of people coming in and seeking care. This also means that companies producing pharmaceuticals are trying to profit off of the sale of those pharmaceuticals. All of these factors can affect the way in which our health in society is treated. Look, for example, at a consistent issue, maternal death rates. Notice that Black mothers have much higher maternal death rates than other groups. They also have higher preterm rates, low birth weight, meaning undernourished children, and higher infant deaths. What are some of the proximal and distal causes that can help us explain this? Well, we know that from our earlier studies that Black women are more likely to be poor or even in poverty. This means that trying to go see a doctor while pregnant can be very difficult and expensive. Many don't see a doctor at all. If we think about what pregnancy does to the body, it changes in some pretty extraordinary ways. We certainly put on some weight, and we have this little baby growing in us, but there's a lot of factors that have to do with hormone levels, with blood pressure that last a long time after the baby is even born. So when we think of some of those indirect causes, here we can think about poverty, about the lack of insurance coverage. We can think about not being able to eat food, looking at those low birth weights that's healthier for babies. We see this is actually only getting worse over time as well, particularly in death rates and birth weight. So all of these are indirect causes of leading to mortality, higher mortality rates among Black women. Think also what practical policies can be done to help address this issue. For example, many of those maternal deaths happen after birth, and they typically happen through things like heart attacks because the body has gone through so many changes and women suffer from high blood pressure during and after pregnancy. These could be issues that would be solved if doctors were monitoring the mothers, but often these women don't have those choices to make. Another key issue in our society is how do we pay for our medical care? Currently, one report, of a woman who went into hospital to be treated for the coronavirus, often having to be put on a ventilator to help breathe and keep temperature down, left her with a bill of $34,000. If you go into a hospital in England which has a nationalized health service, you never get a bill. The only time you see a cashier is if you need assistance leaving the hospital and getting transportation, and they give you money. My brother in France, we were privileged enough to travel there, once, I think, broke a finger. And we were all like, oh my God, we have to go to this foreign country hospital. We don't have insurance here. And they said, oh, monsieur, we are so sorry. We have to charge you because you're not a French person. And they charged him $25. In our country, often getting sick can mean bankruptcy, losing your house. If your insurance company, because they are trying to profit, for example, wants you to always take an ambulance from a hospital that is in their network that they cover. And if you don't, even if you are passed out when that ambulance picks you up, they can legally send you a bill. This is called surprise medical billing, and it's one of the key issues that is coming up in our current political cycle. Part of what this for-profit system has left us with is not enough doctors and not enough people to respond. What these insurance companies, health management companies, HMOs, health management organizations, and for-profit hospitals have been doing is trying to get doctors to take on more patients and see more patients within a day and pay doctors the same thing. Right? So that means more money coming into the hospital, paying fewer doctors because it's more efficient and more profitable. The Obamacare, or the American Affordable Care Act, was meant to change some of these issues, but it really didn't create a national system. It tried to create better markets or better places for buying and selling healthcare. It certainly did increase coverage, but today many of those gains have been lost because political leaders have undermined this. So today, as our hospitals are overwhelmed and these for-profit companies have cut and cut and cut in order to increase their profits, we see some of the problems with a for-profit healthcare system. It's not prepared to take on things that are unprofitable, and it's not prepared to take on things that are catastrophic. One last issue to think of is how medicine can be seen as a form of bodily control. In the next section, we'll take a longer look at what we call medicalization. But we can think about, for example, whose issues are medical? Why are women's issues often not treated as real issues? Many Black folks in this country, for example, report that they feel like they're not treated seriously by their doctor. And doctors have shown that they even think Black people experience less pain than other groups, which is an old, racist, wrong idea. Women have long had this issue. Because women, as we saw in our gender section, are often treated as irrational creatures, we often treat women as though their actual medical issues are in their head. This has led to key issues like endometriosis, which is an extraordinarily painful experience that some women describe as feeling like your guts are being torn apart by a chainsaw, wasn't really treated as serious. And women go through extraordinary pain and they're told it's all in their head. To expand on this, I'd like you to watch these two rather explicit but very funny clips from Samantha Bee's show on women's medical issues throughout history. The point here is to say that the medical field isn't without its own issues. There are power relationships involved